Hello, and welcome to Wally's Nursing Videos. Today we have an exciting lineup of topics to discuss, ranging from high-risk pregnancies and newborn care to gynecological health, with a special emphasis on contraceptives and infertility. We'll dive into the complexities of each subject, providing you with comprehensive insights and practical knowledge to better understand and navigate these crucial areas of healthcare. So, let's embark on this educational journey together as we explore the intricacies of maternal and newborn health, as well as the latest advancements in reproductive medicine. High-risk pregnancy. High-risk pregnancies encompass a variety of situations where there's an increased likelihood of complications for the mother, the baby, or both. Factors contributing to this designation may include maternal age extremes, very young or older, pre-existing health conditions like diabetes or hypertension, multiple pregnancies, such as twins or triplets, and lifestyle habits like smoking or substance abuse. Comprehensive monitoring and specialized care are often necessary to ensure the best possible outcome for both mother and baby. Hypertensive disorders. Hypertensive disorders in pregnancy involve elevated blood pressure and can range from mild to severe conditions. They include chronic hypertension, high blood pressure existing before pregnancy or diagnosed before 20 weeks of gestation. Management typically involves close monitoring and sometimes medication to control blood pressure throughout pregnancy. Gestational hypertension, high blood pressure that develops after 20 weeks of pregnancy without other signs of preeclampsia. It usually resolves after childbirth but requires monitoring to prevent complications. Preeclampsia, a condition characterized by high blood pressure and signs of damage to other organ systems, such as the kidneys or liver after 20 weeks of pregnancy. It can lead to serious complications for both the mother and baby if left untreated. Superimposed preeclampsia on chronic hypertension. When a woman with pre-existing chronic hypertension develops preeclampsia during pregnancy, it's referred to as superimposed preeclampsia. This presents additional risks and challenges in management. Eclampsia, a severe complication of preeclampsia characterized by seizures in a pregnant woman. Immediate medical attention is crucial to prevent harm to both the mother and baby. HELLP syndrome, a rare but serious condition involving hemolysis, the breakdown of red blood cells, elevated liver enzymes, and low platelet count. It can occur alongside preeclampsia or on its own, and requires prompt treatment to prevent life-threatening complications. Gestational diabetes. Gestational diabetes develops during pregnancy and can lead to complications for both the mother and baby if not properly managed. It involves high blood sugar levels that can affect the baby's growth and increase the risk of preterm birth, cesarean delivery, and maternal complications like preeclampsia. Preterm labor. Preterm labor occurs when contractions begin before 37 weeks of pregnancy, potentially resulting in premature birth. Babies born prematurely may face various health challenges due to their immature organ systems, including respiratory distress syndrome, feeding difficulties, and long-term developmental issues. Preterm, premature rupture of membranes, PROM. PROM happens when the amniotic sac ruptures before 37 weeks of pregnancy, leading to a leakage of amniotic fluid. This increases the risk of infection for both the mother and baby and can result in preterm birth if not managed appropriately. Placenta previa and placenta accreta. Placenta previa. This condition occurs when the placenta partially or completely covers the cervix, increasing the risk of bleeding during pregnancy and delivery. Placenta accreta. Placenta accreta happens when the placenta attaches too deeply into the uterine wall, which can lead to severe bleeding during childbirth. It often requires specialized care during delivery to minimize complications. Torch infections. Torch infections are a group of infections that can be transmitted from mother to fetus during pregnancy and have the potential to cause serious birth defects or other complications. Toxoplasmosis. Other infections, such as syphilis, varicella zoster, mumps or HIV, rubella, cytomegalovirus, herpes simplex virus. Newborn, immediate newborn transition. This refers to the critical period immediately after birth when the baby adjusts to breathing outside the womb and regulates body temperature. Skin-to-skin contact and early breastfeeding support are essential during this time. Newborn assessment. Healthcare providers conduct a thorough evaluation of the newborn's health, including measurements of weight, length, head circumference, vital signs, and screening for any abnormalities or signs of distress. Newborn care and discharge teaching. Parents receive education on caring for their newborn, including feeding techniques, diapering, bathing, recognizing signs of illness, and creating a safe sleep environment. This empowers parents to provide optimal care for their newborn at home. Newborn nutrition. Guidance is provided on feeding options, including breastfeeding, formula feeding, or a combination of both to ensure adequate nutrition for the newborn's growth and development. Newborn complications. Various health issues may arise in newborns, ranging from common conditions like jaundice and feeding difficulties to more serious complications, such as respiratory distress syndrome, infections, or birth injuries. Prompt recognition and management are essential to minimize risks and ensure the best possible outcomes. Gyn Health. Contraception. Contraception, also known as birth control, refers to methods and techniques used to prevent pregnancy. There are numerous contraceptive options available, each with its own benefits, effectiveness, and considerations. Some common methods include barrier methods, such as condoms, diaphragms, and cervical caps, which physically block sperm from reaching the egg. Hormonal methods, including birth control pills, patches, injections, and hormonal intrauterine devices, IUDs, which release hormones to prevent ovulation and/or thicken cervical mucus to prevent sperm from reaching the egg. Long-acting reversible contraceptives, LARCs, such as hormonal and non-hormonal IUDs and contraceptive implants, which provide highly effective long-term contraception with minimal user intervention. Sterilization. Permanent methods such as tubal ligation for women and vasectomy for men, which block the fallopian tubes or vas deferens respectively to prevent sperm from reaching the egg. Emergency contraception, also known as the morning after pill, which can be used to prevent pregnancy after unprotected intercourse or contraceptive failure. Effective contraception not only prevents unintended pregnancies, but also allows individuals and couples to plan and space their pregnancies, promoting reproductive autonomy and overall well-being. Infertility. Infertility, defined as the inability to conceive after 1 year of regular unprotected intercourse, or 6 months for women over 35, or the inability to carry a pregnancy to term, affects millions of individuals and couples worldwide. It can stem from a variety of factors, including physiological, genetic, hormonal, environmental, and lifestyle influences. Understanding the underlying cause is crucial for effective treatment and successful conception. Causes of infertility. Female factors. These may include ovulation disorders, such as polycystic ovary syndrome, tubal blockages, uterine abnormalities like fibroids or polyps, endometriosis, or age-related decline infertility. Male factors. Male infertility can result from low sperm count, oligospermia, poor sperm motility, asthenospermia, abnormal sperm morphology, hormonal imbalances, or structural issues of the reproductive organs. Combined factors. Infertility can also arise from a combination of male and female factors, or in some cases it may be idiopathic, of unknown origin. Evaluation and treatment. Diagnosis of infertility involves a comprehensive medical history, physical examination, and various diagnostic tests. These may include semen analysis, hormonal tests, ultrasound imaging of the reproductive organs, and sometimes more invasive procedures like laparoscopy or hysteroscopy. Treatment options depend on the underlying cause and may include medications. Fertility drugs can stimulate ovulation in women with ovulatory disorders or regulate hormonal imbalances. For men, medications may help improve sperm production, motility, or quality. Assisted reproductive technologies, ART, in vitro fertilization, IVF, is a commonly used ART procedure that involves combining eggs and sperm in a laboratory setting to create embryos. These embryos are then transferred into the uterus, where implantation and pregnancy can occur. IVF may be recommended for couples with various infertility factors, including tubal blockages, severe male factor infertility, or unexplained infertility. In some cases, intracytoplasmic sperm injection, ICSI, is used during IVF to directly inject a single sperm into an egg to facilitate fertilization. Surgical interventions. Surgical procedures such as laparoscopy, hysteroscopy, or varicocele repair may be performed to correct anatomical abnormalities, remove obstructions, or address conditions like endometriosis. Lifestyle modifications. Making lifestyle changes such as maintaining a healthy diet, managing stress, reducing alcohol and tobacco use, and achieving a healthy weight can positively impact fertility outcomes. Emotional and financial considerations. Navigating infertility treatment can be emotionally challenging and financially burdensome for individuals and couples. It's essential to prioritize emotional well-being and seek support from healthcare providers, counselors, or support groups. Additionally, understanding the financial implications of infertility treatments, including insurance coverage and out-of-pocket costs, can help individuals make informed decisions about their care. In vitro fertilization, IVF, involves the removal of one or more eggs from the ovaries, which are then fertilized by sperm in a laboratory setting. This method is particularly successful when using the individual's own eggs and sperm, or donor sperm if needed. For specific conditions, tubal disease or tubal ligation. If a patient has tubal disease or has undergone tubal ligation, IVF is often recommended as it circumvents the fallopian tubes, allowing for pregnancy to be achieved directly through fertilization in the laboratory. Severe male factor infertility. In cases where semen analysis indicates insufficient healthy sperm for successful basic treatments like intrauterine insemination, IUI, IVF with intracytoplasmic sperm injection, ICSI, can be employed. ICSI involves injecting a single healthy sperm directly into each egg, addressing male factor infertility more effectively. Endometriosis. For women with endometriosis, where endometrial tissue grows outside the uterus, IVF can be beneficial. The condition can interfere with fertility, but IVF bypasses these complications by fertilizing eggs outside the body. Recurrent miscarriage, defined as 2 or more consecutive pregnancy losses before 20 weeks gestation. Recurrent miscarriage can be emotionally challenging. IVF with preimplantation genetic testing, PGT, can help identify healthy embryos before transfer, potentially reducing the risk of miscarriage. The IVF process typically involves ovarian stimulation injectables containing hormones like follicle-stimulating hormone, FSH, and luteinizing hormone, LH, are administered for 8-14 days to stimulate egg production. Monitoring. Hormone blood tests and pelvic ultrasounds track cycle progress and adjust medication doses as needed. Trigger shot. A final injection of human chorionic gonadotropin, HCG, or Lupron is given to induce final maturation of eggs before retrieval. Egg retrieval. Under anesthesia, eggs are collected using ultrasound guidance, a process lasting about 20 minutes with additional pre- and post-op care. Sperm preparation. Both fresh and frozen sperm samples are processed to select the healthiest sperm for fertilization. Fertilization. Eggs are fertilized either conventionally by incubating them with sperm in a petri dish or through ICSI, where a single sperm is injected into each egg center. Embryo development. Embryos are monitored for progressive development until the blastocyst stage, typically around 5 or 6 days post-fertilization, to select the highest quality embryos. Embryo transfer, a straightforward procedure done without anesthesia, where embryos are deposited into the uterus via a catheter guided by ultrasound, usually with a full bladder to aid visualization. Pregnancy testing. About 10 days after embryo transfer, a blood test is conducted to detect pregnancy hormone, HCG levels. Thank you for joining us today on Wally's Nursing Videos. We hope you found our discussion on high-risk pregnancies, newborn care, and gynecological health informative and engaging. Remember, knowledge is power when it comes to healthcare, so continue to stay informed and empowered in your journey towards better health and well-being. If you have any questions or topics you'd like us to cover in future videos, please don't hesitate to reach out. Until next time, take care and stay healthy.